Well, today wraps up Black Maternal Health Week, but as we know, this is an ongoing issue and a matter of life or death for so many women.
Yeah, according to the CDC, black women are 3 times more likely than white women to die while giving birth. Many of these deaths are preventable if you recognize the signs, then get a timely diagnosis and quality care.
We do appreciate you staying with us here at 4:30. I'm Candace Gibson.
And I'm Erin E. LeBeau. This week in particular is all about raising awareness. And to help us do that is Dr. Dawnette Lewis. She's the director of Northwell Center for Maternal Health and joins us to help prevent what could be a life-threatening issue. Welcome to the show.
Thank you for having me to discuss this very important issue.
Yeah, doctor, let's go ahead and jump right in. So why are black women so much more likely to have birth complications?
I think the answer is multifactorial. It's related to pre-existing conditions. It's also related to how black women are treated when they enter the healthcare system, and the fact that oftentimes when black women express concerns that they're not heard.
What are some of the issues that they actually face?
Well, we know that chronic hypertension is higher, pre-existing diabetes is higher, and those can lead to complications in pregnancy. So I think it's very important that even before someone becomes pregnant, because 50% of pregnancies in the United States are unplanned, that if a patient is considering a pregnancy, that they try to manage their blood pressure as well as they can, and if they have diabetes, to try to manage their blood sugars as well as they can before becoming pregnant.
One of the other complications on the screen that we saw was preeclampsia. We've been hearing a lot about that, people a lot open about talking about that, but what are some of the warning signs to watch out for?
Some of the warning signs: if you have a headache that's not relieved by Tylenol or with rest, if you've gained more than 5 pounds a week, if you have nausea, vomiting, particularly swelling in your hands and your face, and any abdominal pain or any stomach pain. So those are some signs and symptoms that may alert you to the fact that you're at risk for preeclampsia.
What happens if a woman feels like a doctor is not taking her seriously? What would you recommend her doing?
I'd recommend one, maybe being a family member or an advocate with them so that they can advocate for the patient as well. And also, if you feel like your clinician is not listening to you, then you should change physicians or change your care provider to someone who you feel is willing and are able to listen to your concerns.
Doctor, do you think that doctors are being trained to properly understand the cultural differences when treating a black woman or a white woman or a woman of another race?
I have to say that medical training has changed tremendously since I was a medical student. And I know that many medical school curriculums are now changing to discuss cultural competency. So when they see a patient that doesn't look like them, that they are aware of the cultural differences.
You're the director of a program called the Mom's Navigation Program. What are the goals for that?
So I'm the director for the Center for Maternal Health, and the Mom's Navigation Program is one of the programs under the center, and it provides wraparound care and transitions of care once the patient is pregnant. And so this program came out of COVID when we needed help with patients being discharged early from the hospital. And what we found from that program, which is backed by nurse practitioners, RN, and multi-specialty care, is that for the 30 days after delivery, patients who were part of that program were able to decrease their readmission rate by about 50%. But for a Black patient, 30 days after delivery, that program was able to decrease their readmission rate from severe maternal morbidity or complications by about 60%. And so we are building on the success of that program to apply to, hopefully in the future, all the patients that deliver at Northwell Health.
All right. Well, Dr. Lewis, thank you so much for joining us today.
Thank you.